Hey, everybody, we're going to get started in just a moment. OHA folks, if you see Dan, Jeanette, or Craig come in, can you let me know? I'm checking, but I just want to be sure. Good morning, everybody. We're going to get started in just about a minute. I'm going to give our CRB members a moment or two to join because I want to make sure we have everybody. I see Craig joined. Well, let's actually get started, and we can start with introductions. So I'll ask the CRB members, I'll go around the room. Welcome everybody to the June 13th Community Review Board. This is the final meeting of the Kroger-Albertsons Community Review Board. This is Diana Bianco with Artemis Consulting, and I have been the consultant and facilitator for the CRB. So thanks for joining us. Let's do quick introductions of CRB members. I'll just go down the list. Alyssa, if you could introduce yourself.
Hi, Alyssa Pennicook. I live in Medford, Jackson County, and primarily stay-at-home mom with a background in human resources and employee benefits.
Thanks, Alyssa. How about Craig?
Hi, everyone. I'm Craig Newton. I reside in Medford, Oregon. I am the chairman of the board at Jackson Care Connect, and I am the co-chair of the Community Advisory Council for Jackson Care Connect. Nice to see everybody.
Thanks, Craig. Kevin.
Hi, my name is Kevin Knutson. I live in Milwaukee, Oregon, just outside of Portland, and I am a pharmacist with a smaller company called High School Pharmacy.
Thanks very much. Laura.
I'm Laura Johnson. I work for SEIU here in Oregon, and I reside in the Portland area.
Thanks, Laura. David.
Hello, my name is David Hill. I live in the Eugene Springfield area of Lane County and shop at Fred Meyer's, Albertsons, to name a few, and a member of the Coquel Indian tribe as well. Thank you.
Thanks, David. Dan.
Yes, good morning. Sorry, I'm tardy. My name is Dan Kennedy. I'm a pharmacist. I'm president of the Oregon State Pharmacy Association, and I guess I'm the newest member of the Prescription Drug Affordability Board.
Nice to see you, Dan. And then I'm not sure if Jeanette's here yet. Okay, so we can get started. I think Jeanette will be joining us. Thanks, everybody, for joining us today. Let's go to the next slide. So just meeting logistics, this meeting's being recorded, closed captioning is available. CRB members, please raise your hand or you let me know that you want to speak, and please remain muted until it's your time to speak. Let's go to the next slide. And before we do this, these are public meetings, as folks know, and the public can attend and view these meetings. If the public wants to provide comment, you can email HICMO, and if we could put that in the chat. So there's always opportunity to provide public comment in a variety of ways. So we will put that in the chat in case folks have anything that they want to share about the transaction. So here's our goal. Today is our final of this community review board. And the goal is to approve the recommendation to the health authority about the transaction. And we will review that recommendation. You received, and this is posted in the meeting materials, you all received the draft memo. So the goal today is to approve that draft memo and look for consensus, which has been our model. We'll talk about next steps, and then we'll take some time for any reflections, and we'll go from there. Does anybody have any questions about what we're doing? All right. Let's go to, and let me just also preface this by saying, as you all know, we spent a good chunk of time at our last meeting discussing the recommendation, and heard from all of you and your feedback about all the information and all the conversations, and all the input that you've gotten over these last few months. So let's go to the next slide, please. So we're going to talk about the recommendation and go from there. Next slide. So before we sort of go to that, I just want to be super clear about the two different documents that have been prepared, and that you all have seen and again are posted. So the recommendation memo is the CRB's formal recommendation to OHA's leadership. And that documents the recommendation as well as your rationale. And this final version after today, when we'll talk about next steps, but will be shared with leadership and published on the HICMO website where everything's been. That requires your approval. So that's what we're going to be looking for today. The other document is this summary report, and that is really to be transparent about the CRB's work and your journey over these last couple of months. And that you all saw it. It details the process, the approach, the discussion of issues, and that also will be published to the website, but that does not require your approval because that's really a documentation of the process versus the memo, which is your recommendation. Do folks have any questions about that? Okay. Let's go to the next slide, please. And the links to these documents are in the chat. So the recommendation memo, staff, summarize, I think, the conversations you have had, as well as when we went around and did a temperature check at our last meeting to where you all were at, and we had consensus on that. OHA circulated the draft memo and asked the following questions. Were there any questions? Were there any inaccuracies, major things missing? And we didn't hear back from the CRB members. So we are making the assumption you didn't have any questions. There weren't any inaccuracies. There weren't any major things missing. But before we go to check for consensus, I'm going to do a last call because this is really important, because that memo reflects what your recommendation. And so just want to double check before we go, because our next step is to check for consensus on that memo and to get your approval of that memo. But is there anything else that folks needed to raise before we go to looking at that, looking for final approval?
No, I thought, sorry, I know you're asking a different
It's
question.
okay.
But I thought the memo was quite accurate, so thank you.
Great, thanks, Dan.
Yeah, I agree. I just wanted to express appreciation for summarizing everything, I think, really well in both documents. So
Thank you, Laura. Craig.
Yeah, I will agree with everyone. I thought it was excellently done. The note taker was great at putting down what our thoughts and so on. So I thought it was complete and accurate. Thank you.
Thanks. Great. Okay, so let's go to the next slide. So this is checking for your approval of the CRB recommendation memo. Once if we have consensus on approving it, it will then go in your name from you to the health authority. We'll detail the next steps at the end of the meeting. So I'm going to go around the room and check for consensus. that you approve the CRB memo, and I'll just go down the list. Laura,
Yes, I approve it.
Craig,
Yes, I approve the memo.
David,
Yes, I also approve.
Kevin,
Yes, I approve the memo as well.
Alyssa,
Yes, I approve.
Dan,
I approve as well.
and do we have Jeanette? I don't think we don't, it doesn't look like we have Jeanette. So couple things, we will explicitly check with Jeanette to make sure she is on board as well. And though under our decision-making guidelines, it says that if we can't reach consensus, which is not the issue, we have reached consensus, that we can vote, and we just require a quorum, which we have. So officially, by those guidelines, you all have approved this, and we will double check with Jeanette, who did indicate at our last meeting that she was in favor. She was in favor of all of your recommendation of disapproving the transaction, or recommending disapproval of the transaction with the rationale that we had. So we're going to have to check with her to make it official, and we will do that immediately following the meeting if she doesn't come before the end. Craig, please.
Will this affect anything with her not being here? I know we have a quorum, but does she have to agree with us? I don't know the ground rules. Thank you.
So Craig, so what we've said in our decision-making guidelines is that we will strive for consensus, which we have amongst this group. To sort of cross every T and dot every I, we are going to reach out to Jeanette and say, are you in consensus with this? So that will be that's what we will do. However, in our decision-making guidelines, this is what I want to be crystal clear about. We say, if, there's not everybody here, if we don't have complete consensus, as long as we have a quorum that have approved things, we're good. So we're officially good, right? And I want to make sure that we have, and we can document full consensus. So that's why we will reach out to Jeanette to ensure that. Does that answer your question? Okay, so I think the CRB has just approved the recommendation memo. We will circle back to Jeanette and then let everybody know the result of that. Anybody have any other questions? I mean, you all have just approved the memo because by vote or by consensus, you've done that. Okay, so congratulations. You've done a lot. You've done a lot of work. You've done it so you've made your recommendation, and we'll talk at the end about all that work that you've done. Thank you. The next piece is what happens now. And so anything else before we move on to the next steps? Okay, can we go to the next slide, please? And then the next slide. And I'm going to turn it over to the Health Authority to sort of help remind folks how this whole process, the CRB process, fits into the Health Authority's overall process. So I'm going to turn it over to Jenny and Stacy.
Thank you, Diana. And I apologize, I have a little bit of noise in the background. Hopefully it's not too loud. Again, you all know me, but for folks who haven't been on these meetings, my name is Jenny Grendis. I'm the policy advisor for the Healthcare Market Oversight Program at OHA. And so this diagram we've looked at several times, and it shows the different considerations that go into OHA's decision. And we'll go to the next slide. So now that we have go back one, please. Now that we have the CRB's recommendation, we have these other pieces that are still in process for OHA to reach a decision. And I'll talk a little bit about sort of what we'll do from here. So if we go to the next slide. So we will continue to work on the analysis of the transaction and the to inform our assessment of whether the criteria for comprehensive review are satisfied or not. That includes things such as looking at impacts on competition, looking at impacts on financial stability, thinking more about aspects of impact for access to pharmacies, and sort of continuing to get additional information from the entities that we need for those analyses. So we're currently reviewing the materials that were submitted by the entities in May, and the review period is pulled or paused pending our confirmation that we have all the information that we need. So that is sort of what we're doing at the moment. We'll also be continuing to monitor state and federal actions in the FTC lawsuit, and which Oregon has also joined, related to this transaction, to see how that pans out. And we'll continue to accept public comments throughout the review. And currently, we don't have a timeline for completing the review. As you, I think, understand at this point, it depends in part on how long it takes for us to get the information that we have asked for, that we need for from the entities. And with that, are there any questions on any of that? Okay, I'm not seeing any. Oops, one. Couple. Okay.
Oh, yeah, sorry,
Okay.
I was slow on the draw there, sorry. So I guess we have no end date for the review, if I've heard you correctly. So will we reconvene if something earth-shattering comes through the review process? I guess I'm just wondering if there's an October surprise or something in store here that they may just toss in toward the end. Just curious.
That is certainly something that we have discussed as an option, and so if that is something that folks are interested in, and I think we would have to assess what if there's new information or changes to the transaction, whether we continue to review the transaction in sort of within the current sort of review process, or if it becomes a completely new transaction that we would have to then do a completely new process for, and potentially have another community review board. So, but we will, I think that's an option that we have. And so I appreciate you bringing that up, and something that we will consider if that situation arises.
I would add that we don't plan to reconvene the community review board, and it might depend on what the October surprise is. It's a possibility, but we're not currently planning to reconvene the community review board, and there's different options based on the type of surprise that we would encounter.
Okay, thank you.
David, go ahead.
Thank you. Can you clarify that October surprise? My question was similar to along the same lines as Dan, as far as the open-ended time frame for the toll. I think it was initially 180 days, but it's currently sort of paused until if and when the entities get responses to those that information that OHA had asked for. And how does that, the pending sort of litigation with FTC filing in Oregon, is that the October date? And I'm just kind of curious how the two, I know OHA has their own independent sort of recommendations to the state, and then also this sort of litigation that's sort of pending. But can you kind of speak to just sort of the timeline, if it's sort of open-ended for that recommendation, but then just curious how those two timelines might intersect, and if this will just stay open even through that pending litigation.
And I just quickly wanted to clarify, when I said October surprise, I was not referring to like October 2024. I was referring to as like a phrase for like something happening right before an election. So like a last minute surprise. So I did
Right.
not mean to imply that we're expecting something to happen in October. More of just like an idiomatic phrase. Sorry about any confusion.
Yeah, I can add on the FTC lawsuit, the timeline for that. We are aware that there's an administrative hearing that is scheduled for July 31st, and that is so that sort of would be the start of the sort of the hearing, or the trial, if you will, before the FTC. And then there's also a hearing in the federal court case where the state of Oregon is one of the plaintiffs, that's scheduled to begin on August 26th. So, and that's where the plaintiffs are seeking to get an injunction to block the merger until the FTC proceeding is completed. So I expect that something, we'll have some news, or there'll be some more, decisions made later this summer. That's, I guess, all I can say at this point.
Okay. Thank you, Jenny and Stacy. Let's go to the next slide. So I'll talk about this. The next slide, the next steps for the CRB. So you all have approved the recommendation. And so we are gonna email Jeanette, but that's sort of, it's not required, but we're gonna do that just because it's good practice. And so we'll email Jeanette, make sure she's on board, and you all have approved the recommendation. So that final recommendation will go to OHA leadership. You all will be copied on that. The staff will post the final memo and summary report to the website. And then here's where we want your help. As we talked about at the beginning of this process, this is the first community review board that HCMO has done for a transaction, and we really want to learn from this process. So we're going to send you all a short feedback survey to give us feedback on what we did well, what could use improvement, any advice from all of you who have been participants in this on the CRB. And that's part of a whole, process improvement, making it better next time. So we'll do that survey. If anybody, any of the CRB members want to have one-on-one interviews or feedback discussions, we are open to that as well. So if you want to do that, please email Jenny and or Stacy and let them know that you're interested in doing that. But we will get that feedback survey out as soon as possible. And you can always, you have the email, you also have the website link for where all the materials are stored. Any questions? Craig, go for it.
Thank you. Does the staff prefer one over the other, a one-on-one survey versus the email one? Thank you.
I would love it if everybody can complete the survey, and then we're kind of envisioning the one-on-one conversation as an opportunity to drill down on any feedback you might have, and to learn more. So if you'd like to do both, that would be great. We didn't want to we want to be respectful of people's time, so we didn't want to require one-on-one conversations, but that's an opportunity for us to get into more depth and have some dialogue about any opportunities for improvement.
Well, that's fine. I'm willing to do both. Thank you.
And I would say it probably makes sense to do the survey first, And then you can see like, oh, there's a survey, but I have so much more. I really want to share about this, this, and this. So we'll get that out. And then Craig, that's great. And everybody feel free to do that one-on-one. If that feels like you have additional information you want to share, we're really open to it and would love to hear from all of you. Any other questions? All right, so there's one final piece of business. If we could go to the next slide. And that is really to thank all of you, members of the CRB. And I'm just going to start. I do a lot of work with a lot of groups in Oregon, and I've been doing it for many, many, many years. And you all have just done a fantastic job. And I'll tell you why I believe that. We've had full participation. I don't know that anybody missed any meetings, and I don't recall if anyone did. And if you did, you caught up, you reached out. And so we heard, and you all participated. We heard from all of you consistently over the course. And so that sort of presence and participation is amazing. And thank you for that. You all did your homework. You read everything that was sent to you. And the reason I know that is because you asked questions about it and you went deep on it and you raised it in different meetings. And so all those good questions and those sort of robust discussions, probing issues really is notable. So thank you for that. And the last thing I'll say is this work and all of you really embodied, I think, Oregon's commitment to community engagement and lifting up community voice. And so really want to acknowledge that your knowledge, your expertise, and that community perspective that you brought to the work. So it's real gratitude and it's real thanks and it's acknowledgement of your volunteer time and energy and thinking on behalf of your communities. And that's just invaluable. So thank you all so much for that.
I will jump. Oh, sorry. Go ahead, Craig.
Go ahead.
Let's go to Jenny and if Stacy has anything, and then we'll see if anybody else wants to say anything. Go ahead, Jenny.
Thanks, Diana. Yeah, I'll jump in, but I couldn't say it better than that. So I completely agree with everything that you just said. And on behalf of OHA and the HICMO team, wanted to extend a huge thank you to everybody for their time, for the thoughtfulness that you put into this and your engagement with this process. And just, I can say at a personal level, and, also in terms of like thinking about this transaction, we've learned a lot listening to your discussions and your views on this, and we'll take that with us as we continue the review. So thank you.
I would just echo what others have said. And I also just really appreciate your flexibility and willingness to work with us through this process. It's been great working with this group and this is our first time going through this process, and you all made it easy to do. So thank you.
Thanks, Jenny. Thanks, Stacy. Go ahead, Craig.
Thank you. I was just gonna go. I don't have anything prepared, but I was gonna say I do quite a bit of volunteer work, and this group was very easy to work with. I thought it was a great group of people. Stacy and Jenny were really easy to work with. I contacted them on various occasions via email. They always got back to me immediately. And finally, Diana, is it Diana or Deanna?
Diana.
Diana. No one's more suited perfectly for their job than you. Somehow, I don't know if you chose the career chose you, but you're perfect at it. And you really guided our meetings real smoothly. And you're very efficient and you have a real nice down to earth way about you. And anyway, I really enjoyed working with everybody. And it's kind of sad that we have to end this, but I enjoyed working with all of you. Thank you.
Thanks, Craig, so much. Okay, folks. Oh, Dan.
Yeah. I just want to kind of be an echo chamber here with Craig, but I'm involved in a lot of meetings and a lot of facilitated meetings. And Stacy and Jenny, I think you guys did a great job laying out exactly what we needed to know, exactly what the process was going to look like. And I appreciate it. It made it very, very easy to track along with you. And Diana, I agree. You're like Miss Facilitator of the world. So thank you for keeping our meetings moving and keeping us on task. And you did it with a gentle velvet glove, and I appreciate that. So thank you all.
Thank you, Dan. Okay, folks. Oh, Kevin, go for it.
I mean, I don't want to take up too much time, but I just wanted to echo what everybody else is saying in terms of, yeah, your professionalism, sorry, of Stacy, Jenny, and Diana was great. The summaries before each meeting were always seemed like really on point and excellent about what we had talked about. I'm sure it's not always an easy job to, manage this project. And then just, I felt like I learned something from all of my fellow community board members. Everybody brought something different, and that was really great. Yeah, it's my first experience really doing something like this. And so I felt like it went really well, and just wanted to say thank you to everyone.
Thank you, Kevin. Alyssa, please.
Just also wanted to say thanks. I've enjoyed this time and everyone's collaboration, and all the folks at OHA. You guys did such a great job of objectively documenting what we talked about, because I know there was a lot of back and forth, and I hadn't heard it mentioned yet on the call. But I'm guessing we probably all saw the OPB story that came out last week about pharmacies per capita in the state. I can send it in the chat if you guys didn't see it, but I just thought it was really timely, and I thought it was good backup of everything that we talked about, because everything in that article was why we had the discussions that we did and came to some of the conclusions that we did. So I thought it was a kind of a good validation of what we've been talking about.
Thank you, Alyssa. Laura.
Yeah, just also, Alyssa, I was also you reminded me that I also read that article, and yeah, it had kind of singled out Oregon as especially bad, right, in terms of pharmacy access and in terms of independent pharmacies. And it was like an AP analysis nationally. So it made me feel really good about our recommendation and kind of really validated a lot of what we talked about here. And also just to say thank you again to OHA. And I think this group has been really worked together really well. And I've also learned a lot from everyone here. So thank you for everyone's participation.
Thank you, Laura. David.
Yeah, I just wanted to express my appreciation as well. Learning from all of these folks here on the Community Review Board. Like Kevin was saying, I think everybody brought just a unique perspective and added to the sort of learning that comes along with reviewing this transaction. So also want to express appreciation to Stacy, Jenny, and you, Diana, for just a seamless facilitation and getting us information and sort of laying out in an organized way, just very easy to follow the process. And also want to express appreciation to everybody that submitted the public comment, even the entities that came on to participate in public comment. It's just, I wish we could have had more information, but look forward to sort of following this along. And thanks again. I really appreciate just being able to express my personal opinions and statements and be a part of this process. So thank you.
Thanks, everybody. Really, as I say, a great process all around. And the process is actually only as good as the folks who participate in it. So really appreciate, as I say, your participation and commitment to lifting up community voice. So thanks very much. We're actually even ending early. Look at that. Really want to, again, thank you all, and we will be in touch. You'll hear from us if anything comes up, if you have any questions about the next steps, what happens next with the memo, all of that stuff, but you'll see all of that via email. Thank you, everybody, very much. I hope you all have a great rest of your day. Take care. Bye-bye.
Bye, everybody.